You need to have people that have complementary skill sets. You need to have people that have different points of view because you can miss something if you have everybody thinking and acting the same. All of this is like a puzzle. There isn't one piece of information that's just kind of like a yes or no, black or white.
Why do you think they fail? And what is it that you think we as an industry could do better with the whole associateship concept?
So maybe you onboard an associate, and this associate really has a long term plan to be a partner or an owner, and that's off the table for the person that's hiring.
Yeah.
Neither of them communicated that.
Yeah.
And then it dissolves and fails. It's realigning, realigning, realigning. Associateships are mentorships. It's not autopilot. And I think that's why they dissolve most oftentimes. Honestly, it's not necessarily a bad thing to have a doctor say, actually, I really enjoy being a longer term, associate or just an associate for forever, because you don't have the stress like a business owner. We understand treatment plans can definitely vary, and we actually really do appreciate different diverse perspectives. I mean, we have that even in our own practice. But so what we're looking for is how this person is arriving at their treatment plan more or less than the treatment plan itself. Like, we want to understand how they think, and does it align with our practice philosophy? And so here we do like to do comprehensive dentistry. We also like to find the root causes for things for patients. We want them to have long-term good health outcomes. We're always looking for ways to not only provide better care, faster care, more reliable, longer results for people, all those better quality products, all those things matter. And so we're looking at this new associate to come in, and we want to see, are you focusing on the tooth, on the quadrant, the mouth, the person? Like, what's your focus? And then we can go from there. And so we look for practice philosophy in that instance, in addition to what their scope of clinical knowledge is, as well.
What about personality testing? Do you put them through any of that? Or is Craig's BS detector enough?
Both of them. Yes, you definitely need both. Yeah, we do. We use what's called Culture Index.
Okay.
Culture Index is similar to like a disc profile type of thing, but it doesn't really put you into like five separate categories. Culture Index gives us a little bit more in depth to the way that the traits of this person. All of this is like a puzzle, right? So there's information for everything, and there isn't one piece of information that's just kind of like a yes or no, black or white. You have to take all of this into context. And we do that even with the personality testing. Like, there isn't just one personality type. What also works when you mentioned, I'm going to back up here a little bit, when you mentioned the relationship or the partnership between practice manager and practice owner, you need to have people that have complementary skill sets. You need to have people that have different points of view, because you can miss something if you have everybody thinking and acting the same. You're going to miss a big part of what else is out there. And so what we do for these potential associates is we do invite them to come in, but they come and they spend time with our team a lot of times, typically up to 2 full work weeks, full time,
Okay.
not touching a patient. And they come just to see, we want them to feel like they fit as much as we're assessing their fit for our practice. Like, it has to be mutual. And so we have them interact with the team and ask questions and look at our patient information and our flow and, those types of things. So we actually really get to live out their personality and, how they interact with the team before we have the commitment or even give the offer.
So you probably had the situation where within a day or two, it was very obvious it wasn't going to work, right?
Yes.
And so how do you handle that? Just, I don't think it's going to fit. I mean, I guess you have to be blunt, right? You have to be honest.
Yeah. I think there's always a tactful way of doing things. If it's more of like, hey, this is like we're just not feeling it, I don't really have anything specific, we just kind of leave it politically correct, where it's more or less of like, oh, hey, this is awesome. We've got a few other people that we're interviewing, we'll be reaching back out over the next couple of weeks once we've made our final selections. So we kind of leave it open for them to know, which typically we do. We're always interviewing several people at a time, that we're going through the process with multiple people. And if you make it to the next round, we'll let you know, kind of thing.
Right. And you don't have to draw from Spodak Dental on this. So with Bulletproof, you've worked with hundreds of doctors. And so maybe drawing from that experience there, we always hear that associates fail. like something, I don't know, they always say it's like 50% of associateships fail. And that number, it's just so believable, right? So who knows what the actual number is? It's so believable that half of them fail. And in your experience working with all these different practice styles and practice managers and personalities and all of that, first of all, why do you think, if you do think they fail most of the time, I should have clarified that, why do you think they fail? And what is it that you think we as an industry could do better with the whole associateship concept? I mean, what would you, if you could wave Erica's magic wand, how do we fix this associate problem?
I would actually agree that most associates fail. We've certainly had several failures as well, that we've learned a lot. And this is going to sound really like maybe even shocking. So we are a very, very large dental practice. We have probably ourselves been through 40, 50 associates, over the years.
It sounds like a lot, people, but honestly, when you're busy and you've got that much, I don't think that sounds too off, honestly. So knowing about your practice like I do. So I'm sorry, just want to say she's not firing everybody, people. That's
No. Well, and there's, people move and people have kids and people, want to change their days or want to have a different type of practice philosophy. So it's not all bad. People leave for all different reasons, or we let them go for all different reasons. But we have had the reps in from like learning what works and what doesn't. Because I think you're bringing on your first associate. I mean, you don't know what you don't know. And then you learn pretty quickly and you're like, I'm going to change this for next time. And then you find out the other 10 things you forgot and you change the next thing. So it is all trial and error. But I think what typically happens, and the reason why, is that when you're doing the initial fielding of the associate is, number one, not properly communicating what you're looking for, what are your expectations, and then also not finding out what does this person want. So if we go back to the most important thing that we can do is to communicate to our team and to find out what their goals are, short-term and long-term. We don't do that for associates either. And so maybe you onboard an associate and this associate really has a long-term plan to be a partner or an owner. And that's off the table for the person that's hiring. Neither of them communicated that. And then it dissolves and fails.
That's so spot on. I immediately, like 3 dentists I know, that's exactly what had happened in their practices. They did not plan on making them partners. They thought this was going to be just a really good situation for them to come in and be an associate. And that's absolutely right. Yeah.
So I would say that, the communication, being very, very upfront with that. I think the other thing that why it fails is, again, having kind of those frequent conversations. So especially in the beginning, when you're bringing on the new associate, you need to have somebody needs to, whether that's you have a clinical director, maybe it's the office manager, or if it's a practice owner, they need to be meeting with this doctor weekly, and then you start moving it to every other week, and then you start moving it to monthly. But you do have to have check-ins to say, hey, let's review your cases. Let's talk about, did you have any challenging patients? How is your support team? How are you doing with the technology they have, the supplies? Like, how are we working and getting the results that we want? Because you're constantly trying to figure out, it's realigning. And when you're learning for the first time. So an associateship, in a way, is almost like, hey, we're married.
Yeah.
And then now we're married, but now we're starting to date. Where typically it's the other way around. Like when you date, all you're doing is you're constantly trying to figure out, how do you think, are we aligning in these certain situations? These new scenarios come up. How are we going to approach and problem solve these things together? And we kind of do it backwards when you have an employment. So you need to have defined time. We actually do lunches with our doctors. At minimum, one of our clinicians is having a lunch with one of the newer doctors. And really, again, it's going to be a check-in and talk about that and to talk about things. The other thing that we do is that the practice owner and myself, we have quarterly doctor reviews. So a formal associate doctor review. And we sit down and we talk about, let's look at the numbers. Let's look at the cases. Let's look at the x-rays. Let's talk about the equipment, the team. So the reviews and all the other things. Part of why it fails is because we think that when you bring on a professional like a doctor, that they know everything, or they know what we know, and that they can read our minds, and they'll follow suit with our expectations, and it was never communicated. And as we know, and I think it's getting better, but dentists don't have a lot of curriculum around business ownership. And even as an associate, we expect them to act like a business owner and to be able to make those decisions like on behalf of a business owner, and to treat this as if it were their own. And we have to be their mentor. So associateships are mentorships. It's not autopilot. And I think that's why they dissolve most oftentimes.
definitely the responsibility of the mentor doctor. They do have to check in. They have to make sure everything's going okay. I mean, that's maybe a role that maybe a lot of owners don't think about, that they actually have a responsibility to improve this associateship as well. What I have noticed, and I'm curious if you're seeing this too, is that there are associates out there now, they don't want to be practice owners, which, it's just different for different stroke for different folks, but they don't want to be business owners. And so they do go and associate. Now, that doesn't mean, though, that they come in with ownership mentality. They actually do see it as employment and employment only. And that is not something I ever came across in the early years of dentistry. I just never saw that, because I think most dentists, I am older, most dentists wanted to own their own practice. So now we have a lot of dentists graduating who they're okay with not owning their own practice, or maybe that bug doesn't hit them until later in their career. So they're quite fine just becoming an employee. And, I think there are lots of really good DSOs that don't foster that, but there are a lot that do foster that. And I don't know if it's because of that, or if maybe just generations coming up, they don't want to work as hard as we do. I don't mean that they're not hard workers. They just see that we worked our butts off. Like, we're like exhausted at the end of the day. They're like, there's got to be a better way. So do you see the same thing, like associates coming up that don't necessarily want to be business experts and owners? They just want to do dentistry and go home. Is that something that your doctors have come across?
You know what? Honestly, it's not necessarily a bad thing to have a doctor say, actually, I really enjoy being a longer term, associate, or just an associate for forever, because you don't have the stress like a business owner. Your money's not on the line, and it's easy to move on if you need to move on and not have to work through the relationship as if you had something legal and pen to paper. However, what we find for associates that treat it more as an employee versus like a professional, like somebody, and here's what I mean by that, is sometimes when I think of an employee, it's like, I'm going to come in, I'm going to clock in, clock out, do the minimum that's required. And then what we find for those people is that then they're surprised why they're not getting the same level of results. Because anything that we do, and I'm going to quote Dr. Craig again here, is he'll say it's like your signature. From the time that you walk in, it doesn't matter the scope of the project, meaning if you're doing a filling or if you're doing an FMR, all that has your signature on it.
Yeah.
And so you need to show up and you need to perform. And you think about like professional teams, professional athletes. There's a lot of prep work that they do in order to make sure that they're shining when they're on the court. And so even as an associate, for the ones that are really successful, they're doing the diligence that they need to make sure that they're showing up and they're shining. And that doesn't just happen in the 9 to 5 hours.
Yeah.
So you've got to work on your treatment acceptance. You got to work on your love for the profession. Like, people feel what you believe. And so what I mean by that is, just because you say something doesn't mean that there is kind of emotional connection with anybody. It's again with the BS like detector, right? People really can feel and to connect and to resonate with that. And so associates also, they have to come in and they have to have that same level of dedication and drive to constantly improve and to optimize what they're doing, because dentistry is changing, consumers are changing, what patients want are changing. And what we find when we see what are businesses that are the most successful, they're the ones that focus on experience. That's what gets people coming back.
Would you like to hear more? Follow the link for the full episode.